The New England Quality Innovation Network, Quality Improvement Organization, or QIN-QIO, is helping improve care for residents in nursing homes by reducing antipsychotic medication use. Across the nation, there are many nursing home residents who are inappropriately placed on antipsychotic medication without an approved diagnosis.
Well, you know that with dementia, at times you can have behavioral symptoms such as shouting, striking out, physical aggression, vocalizations, and these can be pretty upsetting to other people, whether it's other residents or even staff or family. They can also have signs or symptoms ranging from depression and anxiety to hallucinations and other mental health issues. These symptoms can be the result of physical discomfort, emotional upset, and they can also make people who might not otherwise have difficult behaviors, it can help drive those behaviors. We used to use certain medications to treat these signs and symptoms for people with Alzheimer's disease and other dementia, and that was part of regular care. It was accepted practice. We now know that certain medications, including antipsychotics, are prescribed inappropriately for this, and they can be dangerous, especially for older individuals. The issue in part is that sometimes these are the right medications, but often there's other things that ought to be done instead of an antipsychotic medication. And this is particularly important because these medications can have serious, life-threatening side effects, such as strokes and falls. They can even increase the risk of death for elderly residents, which is why it is really important to talk about this issue.
So we work very well with health-centric advisors. We're very data-driven. We look at our QMs frequently, usually about every month. We're reviewing them every week. We're going over things. They've helped us look at other options for us, working with our antipsychotic reduction. Always looking to see what we can do above and beyond what we've already tried to accomplish here. We did do a root cause analysis, and we looked at the fact that we had a lot of adverse events later in the evening. And so we decided to look at what we could do to really redirect those residents and de-escalate some of the situations that were going on. And so we hired a few activity aides for the evening shift.
Sometimes snacks and drinks can help. They might be hungry, but they don't know how to tell us. Puzzles, art, craft, and if that doesn't work, sometimes we take them. Most of the time, we can take them for a little walk with 2 stars. Take them for a little walk on the hallway, in the corridor, talk to them. We have many things that we can do.
So as our team identified gradual dose reduction, we reviewed them with all staff, including our CNAs, our ancillary workers, housekeepers. We individualized each person's plan of care to make sure that we were following everything that they needed to make sure that they were comfortable, that they were getting the best care that they could possibly get. Our nurses, our unit managers work together to make sure the medications, the reduction is going well. We start off slowly. We start with our nursing interventions. They may need a little bit more one-to-one care, or they may need just more restorative care with exercises and walking. They would read some books or magazines, they would play cards. We started a walking program that's been able to prevent falls and also keep the residents engaged with our staff. Once we started our interventions, we saw such a positive outcome. Our activity staff and all of our units do a great job with that.
Hi, my name is Angel Ambert. I am a nurse's aide. One thing that I do first of all is I'll look out for the residents, ask them if they need to walk, ask them if they're in pain, maybe I'll offer them a coffee hour if they want to participate in activities. Maybe a puzzle or a magazine if they like, and sometimes that makes them feel better.
We embrace culture change. We really bring the knowledge of the whole team in with all of our residents and their needs. We do huddles, and we encourage all staff to participate and bring their information about the resident to these huddles so that we can provide very individualized care. We also are a big component of Team Steps. And Team Steps has allowed our staff to feel comfortable voicing their concerns and really feeling like they're part of the team. And our goal always is the safety of the residents.
What can you do to help reduce the use of antipsychotics? Be informed about the risks of unnecessary medication use. Be alert to the signs of a behavior change in the people around you. Be ready to inform the staff of the changes you see. Identifying small changes may make a big impact on someone's quality of life in the future.